So the question is, are we heading for a second lockdown? Recently, the UK's COVID-19 alert level has been raised to 4, which means it is high or rising exponentially. The Health Secretary, Matt Hancock, said the change reflects the significant shift in the current threat posed by coronavirus. He added, this country now faces a tipping point in its response, and it is vital everybody plays their part now to stop the spread of the virus and protect lives. And England's Chief Medical Officer, Professor Chris Whitty, has warned that the rate of COVID-19 infections in the UK is heading in the wrong direction. Elsewhere, Iran has seen its highest daily number of cases of COVID-19 since June, and the USA is approaching 200,000 deaths due to COVID-19. So do I think that the UK is heading for a second lockdown? I think we are, and I think we'll find this out in the next few days. So why has this happened? I think some of the measures relating to the lockdown were eased a bit too quickly. I think the other reason is that people have been too relaxed with the rules and have not been adhering to the social isolation rules as they should have. I think the summertime of break has also played a role in this. But also personally, I've seen many people not wearing their masks properly, such as having their mouths covered but not covering their noses, or letting their masks hang off their ears so it's around their chin, which I'm not sure about yourselves, but which is something that I find particularly annoying. I've also observed people shaking each other's hands and also other forms of physical contact, and also attending big gatherings in people's homes. And some people I've also seen who have refused to get tested as they think they don't have the virus and believing that they have the flu. Now, I'm not sure whether this is denial or fear or whether it's just pure ignorance. So I think, to put it in a nutshell, I think we need to stay safe and follow the rules as much as we can if we want this virus to be over with until a vaccine becomes available, which we hope will become available sometime this year or early next year. Elsewhere, in other news, the CDC, or the Centers for Disease Control and Prevention, updated its COVID-19 guidance to acknowledge the risk that the coronavirus can be transmitted through airborne respiratory particles. But then it was edited on Monday morning to take the information down, saying it was still being reviewed. Before it was taken down, the updated guidance said that the coronavirus is most commonly spread through respiratory droplets, so small particles such as those in aerosols, which are produced when an infected person coughs, sneezes, sings, talks, or even just breathes, and which can remain airborne for a period of time. The virus can then spread to other people who inhale it into their airways. There is growing evidence that droplets and airborne particles can remain suspended in the air and can be breathed in by others and travel distances beyond 6 feet, for example, during choir practice in restaurants or in fitness classes. The CDC's updated but then deleted guidance said, in general, indoor environments without good ventilation increases the risk. But on Monday, the CDC updated the page again to remove the information about the risk of airborne transmission with a disclaimer at the top. A draft version of proposed changes to these recommendations was posted in error to the agency's official website. Instead, the page reads, these droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into their lungs. The Monday update also says COVID-19 is primarily spread between people who have close contact within 6 feet and includes that it may be spread by people who are not showing symptoms. So to put the CDC guidance in a nutshell, this was something that was suspected by a lot of scientists, doctors anyway, that COVID-19 can spread by droplets through the air. Now, whether CDC will make this clear in the next few days or weeks, only time will tell. But interestingly, this has not been reflected, or this current guidance has not been reflected in the guidance that's normally provided by the World Health Organization, also known as WHO. So only time will tell. But I think the moral of the story is that we need to be very careful, we need to stay safe and try to follow and adhere to all the social isolation measures that the government has been put into place. Finally, please also check out my COVID-19 playlist where I talk about the coronavirus vaccine and a second wave, third wave, and how I think the world will adapt around the coronavirus from now. Please also leave any comments in the YouTube description below of how you think you would cope with the second lockdown. And finally, if you're new to this channel, please consider subscribing so that I can continue to bring you valuable medical content to your doorstep. Thank you.